Thank you so much for your time today, Lisa. It's really lovely to see you as always. Could you just start by giving us a bit of a background introduction about who you are?
Certainly. So I'm Dr Lisa Sharkey. I'm a gastroenterologist from the UK. I moved to Dubai here around 18 months ago. I had been working in Cambridge University hospitals in the south of England for a long time. So yeah, life is very different now.
So what was it that made you decide to specialise in gastroenterology, and what did your training involve?
So gastroenterology for me was all about the variety, to be honest. So there's variety in like your day-to-day work. So it's not just clinics or inpatient work. You do clinics, inpatients and procedures. And of course, even within endoscopy procedures, we do lots of different things. So there's lots of variety there. Yeah. You also get variety in terms of some very acute sick patients and people with chronic conditions that you might look after for many, many years. You know, we have patients with inflammatory bowel disease who get married, we see them through pregnancy, you know, all of the big life events, and they stay your patient with their chronic complaint. And then there's variety in terms of, you know, the technology and the way that it's moving forward, and gastroenterology and endoscopy in particular really embraces innovation and technology, and so things are always changing, which is a nice thing. And then I think we're all influenced in some way by people in our lives, and I was really fortunate to have some really great mentors within gastroenterology. I remember a female gastroenterologist when I was a junior doctor who really wanted more women to get into the field because it was very male dominated, and so she really encouraged me. And then during my specialist training, I had another great mentor who actually sparked my interest in clinical nutrition and intestinal failure. So that mentorship was really a big part of it.
Yes, it is actually really rare to find female gastroenterologists because we have such a high demand here, especially in the Middle East, you know, because of the cultural sensitivities. And it's very difficult to find female gastroenterology consultants. I think because the training is very long, isn't it? Like, what did your training involve?
So I qualified from Cambridge Medical School in 2004. And I went into my internal medicine rotation, and then I chose gastro specialty training. I stayed within the east of England, so everywhere was very familiar to me. Then I did some research, and I did fellowships in intestinal failure and intestinal transplant, and that's where I really started to focus on those particular areas within gastroenterology. And my first consultant job in Cambridge was, yes, general gastroenterology, but very much focused on those two specialist areas.
So Lisa, could you just tell us a little bit more about intestinal failure, and what was it that made you become interested in this niche?
So intestinal failure by definition is where the function of the intestine is reduced, so your body's not able to absorb all the nutrients from your food that you need to sustain you. So we need to supplement that with intravenous or parenteral nutrition. So, for example, a patient with Crohn's disease that's had lots of surgeries over their lifetime, has had a lot of their intestine removed, may end up with something called short bowel syndrome. And they specifically just don't have enough intestine left to digest and absorb nutrients from their food, so they need parenteral nutrition. And that's something that is done in hospital, most hospitals, but having it done long term at home is a very specialist thing. The reason I love it is that, two main reasons. So one is that function that our intestine does for us, when it's working, we don't think about it. We digest, we absorb, we evacuate the waste. It just happens and you don't think about it when it's working. But when it stops working, you realise what a complex process it is, what a big impact it has on life. Things like eating and drinking are such social activities, and if someone suddenly isn't able to do that, their life can completely change. You know, you meet friends for coffee, you meet family for lunch. If you can't do that, it's a major impact on your quality of life.
Yes.
The other good thing about this field is it's a true multidisciplinary team arena. You know, there's gastroenterologists, but you've got to have surgeons and dietitians and nutrition nurses and expert pharmacists, and everyone's working together for, you know, the optimum outcome for that patient.
So have you been able to help many patients here in Dubai and UAE with intestinal failure problems, and how were those patients able to find you?
Yes, we have. One of the great things about working at King's College Hospital is the fact that the executive team there have been really supportive of us starting this new service. It was one of the things I wanted to do when I moved, and they've given me the time and resources to get it up and running. So we have a few patients with intestinal failure on parenteral nutrition long term. We have already got the expert surgical experience there. We've got dietitians that are very experienced. We have a specialist nutrition nurse starting soon, which is a kind of unique thing for Dubai, so that's going to be really important for the team. And the patients have either found us themselves from the website and other like social media things that we've done, or they've been referred in from colleagues, which is really satisfying because you want the word to spread that we're offering this service, that we can help these people. So it's been nice to see those referrals coming through.
Yeah, definitely. And are those referrals coming just from doctors in King's College Hospital, or also from other hospitals in Dubai and UAE?
No, other hospitals from within the UAE. So I think we probably still have some work to do to get the word out that we are offering this service, but already things have started to move forward. So I'm really proud of that.
And apart from patients with Crohn's disease, what is there any other patient conditions or any other patients you can help that you could describe?
Yes, so for patients with intestinal failure, some of them have motility problems of the bowel, so the structure's fine, but the way that it moves and things progress through is altered. That's a big group. There are also a number of patients that have what we call acute abdominal catastrophes. So, for example, mesenteric infarction, a bit like a heart attack, but affecting your bowel. That's pretty common. You know, the risk factors for that are things like smoking and hypertension and diabetes. So all of those things are, you know, quite common in this part of the world, unfortunately. So we may see some patients with that as well.
Why did you decide to relocate to Dubai?
Oh, that's a good question. So I had been working in and around Cambridge for a long time, so it was partly feeling a need for a change there. But the job that I was doing there was very special to me, actually. So if I was going to change, I knew it had to be for something completely different. It wouldn't be a matter of moving hospitals within the UK, for example, because that just didn't feel right to me. So something completely different. And I was coming here on holiday, and you had reached out to me, and I thought, well, I'm going there anyway, we should meet. And we did, and you talked me through the kind of principles and what life would be like and what the work life would be like and what to expect. And during that trip, I got such a good vibe from the city, the excitement, the innovation, the progressiveness. You know, it felt like everything was positive, everything was moving forward, and things were starting to look very bleak in the UK, you know. So I came back from that holiday and had to think about it, and then said, yeah, I think that feels like the right thing, and reached back out to you and the team, and you got everything sorted, and I'm so grateful.
Oh, thank you so much, Lisa. So what was it that drew you to work at King's College Hospital in Dubai?
So part of it was instinctive, I think, coming from a UK system and, you know, King's College Hospital London in Dubai. It felt like it would be familiar and maybe make the transition easier. And then when I had the interview with the chief medical officer and the head of department, I knew that that instinct was right, because it felt familiar and comfortable, and they came across as very encouraging and supportive, and so it felt like the right decision to make, and it absolutely for me was the right decision, because that encouragement and support has been there from everybody in the hospital, absolutely everybody. It's staggering, to be honest. So support with big things like setting up an intestinal failure unit, but support with small things like, I don't quite know how this works, or I don't know the right person to talk to about this. People will find the answer for you. It's such a great place to work.
And have you encountered any challenges at all with your relocation, and how have you overcome these challenges?
I think a lot of people would agree the insurance system is the biggest challenge. It takes a little bit of time to learn how to navigate that, but again, there are people who will support you with that, and you just need to ask for help if you need it. The other, maybe not challenge, but the other difference is, you know, Dubai is a global city. There's almost every nationality in the world represented here. So in one day in clinic, you can have patients from 15, 20 different countries, And so your communication style and your interaction has to be very adaptive and dynamic. You can't just communicate in one way with all of those different people from different backgrounds and cultures. So it challenges your interpersonal and your communication skills, but I love that challenge. I love that part of my job.
So Lisa, are you able to get involved with teaching, like medical teaching students here in Dubai? And could you tell us a bit more about that?
Sure, yes, we are. So I have an associate clinical professor role with Gulf Medical University. We have GMU students at King's pretty much constantly. We also take observerships and elective students from abroad. And we have a really great group of resident doctors, and we're really building our educational programme for them. So we have hospital grand round once a month. We run journal clubs with the resident doctors, and we encourage them to do peer teaching as well. So I think they're getting a good educational experience with us at King's, but we're constantly striving to try and improve and build on it.
So you have a really strong track record with research from your previous position at Cambridge University Hospital in the UK, especially with the intestinal failure and transplant area. So are you able to continue that in Dubai and UAE?
I'm still involved with some intestinal failure and transplant things from my old job. We have an upcoming conference actually in Sweden in September. I'm really heavily involved in that. But I've also adapted a bit. So King's is, again, very supportive of research. We have a research committee, research coordinator. A lot of the departments have strong academic track records. Our hospital WhatsApp group, people share their publications very frequently on it. I branched out a little bit recently and wrote an article based on my experience here about managing GI side effects of GLP-1 agonists like Ozempic and Mounjaro. We see a lot of that here. So that was a new experience for me that I was able to translate into a sort of academic slant, which was good. And I think there are many departments here, many hospitals here doing good research. So you absolutely can continue that if you relocate, say, from the UK to Dubai.
Yeah. And how was your experience working with Allocation Assist?
Oh, fantastic. There's a lot of different aspects to medical licensing and getting a job here, and some terminology that you're not familiar with. And I feel a little embarrassed about the number of times I had to ask your team, what does this word mean? What does that mean? What is the next step? But they were always there to answer those questions and just made the whole process so smooth. So I can't recommend you guys highly enough.
Oh, thank you so much, Lisa.